We are going to compare the physical fitness, physical activity, and obesity of youth, particularly young people, among 7 different Asia countries, including Hong Kong, Singapore, Taiwan, Japan, Korea, Malaysia, and China. So we already have all the collaborators lined up, and as soon as we got the funding, we are going to launch a program right away. We're going to compare how fit those children compare to other countries, how obese of our children compared to other countries, and how much physical activity we do as compared to other countries. I think this is important issues that we hope we can get the answer from this research. Actually, I myself as a professor being asked a lot, many times by the mass media like yourself about, okay, are our kids getting very fat, or are they physically weak? Are they having sufficient activities? Are they active enough? I said, I scratched my head. I cannot answer this question because we don't know what to compare with. Okay, if you ask me, our kids are very obese, then my question in my mind is, what are we comparing? Okay, if we are comparing to US kids, it's not reasonable to compare because those are US countries, but we are in Hong Kong. If there are differences, of course there are differences because there are different countries and different people. But if we can compare Asian cities, we have the similar origin, similar culture, but different in culture. And then we have a different health policy that advocated by government. We have different education systems. We have a different family structures. So these comes together influence our physical activity, obesity, and physical fitness. So if we can compare all these Southeast Asia countries, then perhaps we can identify some important factors. Then we find that those are really key factors to affect our health, particularly our activity levels, our obesity levels, and also our fitness. So we hope to identify those factors. If once those factors have been identified, we can suggest some policies for the government, for educators, even for family. Then we can give suggestions to them how we can improve the health of our young people. I think that's why we believe this study is a very important study. One of the NIHA's objectives for the funding is to provide some information that can help for formulating the health policies and strategies for improving health of Asian people. So my study is going to compare the health and fitness of young people among these countries. We believe that young people are our future. So if we want to improve the health of society, we should start earlier when they are still young. So if we can identify some important factors that can affect the health of our young people, particularly the obesity, that is one of the top national objectives in many developed countries and even developing countries. And the other one is physical fitness and also activities. So if you can find out all those factors that contribute to improving obesity and physical fitness, then hopefully we will have a much healthier future in our societies. And eventually, in the long run, that can reduce health costs. And then we don't need to spend that much money in the health systems and Medicare. So that's why I think this study is highly relevant to the NIHA objectives.